you are from a non-medical
Exactly,
background,
yes.
right? And you have an engineering degree, you have an MBA. Why did you come to medical space? I have seen your products. Those are either related to healthcare or clinical research. So, what made you to jump into this? Is it your interest or is it by chance? So, why healthcare and clinical research?
So I think I would have got my, formative years, like they say, right? When you're a child, those are called formative years, and they leave a deep impression on you, and they make you what you are later on in life. Okay. So my formative years in this industry was the time I spent in Dr. Reddy's,
Okay.
3.5 years, and that left a deep impression. That was my first job, and that was a job which I really liked, and I learned a lot of stuff in that, and that I think kind of left a everlasting impression. And I in Dr. Reddy's I was doing multiple things, and that's also where my technology focus came in. So I was in the SAP project. I was in the implementing SAP Dr. Reddy's. Then I was in the supply chain project. So there's a lot of technology and process orientation which came in then. Subsequently, when we started Quad One, I was still in touch with some colleagues from Dr. D's, and then that's when there's a requirement for building a clinical trial software came in. So once that came in, I took it upon myself to learn as much as possible about clinical trials, and so that really sparked off my interest in this whole life sciences space in clinical trials and clinical research. So we built the first product in way back in 2002 2003. Okay, first version of Clinion was built then. It was a very rudimentary version, as you would expect at that time, with that kind of technology and with that kind of background, and where the Indian industry itself was, and where the global clinical research industry was. So it was a client server module. So there was a Java client which would sit on the investigator desktop. Investigator could open that. There were forms which they could fill in and submit. That would get synced to an online database, okay, on the web, and that online database would then open up these files and actually create and display reports. So
Okay.
it's clinical trials, but it was with a technology which is so at that time it was cutting edge, but obviously today it's really obsolete, correct? And then because of my interest, that's how it sparked my interest in both the technology side and the life sciences space. And then I spent a lot of time learning, reading, understanding, figuring out what this whole thing is about. So that's how things fell into place.